Assalamualaikum warahmatullahi wabarakatuh. Om Swastiastu. Salam, Namo Buddhaya. Good morning, distinguished chairs, respected colleagues, and fellow researchers. It is an honor to present our study at the 6th International Conference in Health Science. For today, I will share our research entitled Factors Influencing Sleep Quality in Patients with End-Stage Renal Disease. It is a cross-sectional study, which was compiled by Mr. Madeswandika, Mrs. Wong Rutang, Mrs. Rahmaya Nova Handayani, Miss Yuniar Melisa Kisdayanti, and the Ayodhya Santambujana, and with the affiliation Department of Anesthesia, Faculty of Health, Harapan Bangsa University, Central Java, Indonesia, and School of Nursing College of Medicine, Changgung University, Taoyuan, Taiwan. Here are the background of our research. Chronic kidney disease, or CKD, remains a major global health challenge, affecting approximately 697.5 million people, or 9.1% of the population in 2017. Once CKD progresses to end-stage renal disease, patients rely on renal replacement therapy, either hemodialysis or transplantation. Beyond cardiovascular complications, ESRD patients often suffer from physiological impairments, and the most common being poor sleep quality, which can affect up to 50% of patients. This condition frequently manifests as sleep apnea or restless leg syndrome, both of which negatively affect health and survival. Here are the objectives of our research. CKD progressions follows a clear path from normal kidney function to increased risk, kidney damage, reduces kidney function, and finally kidney failure. Despite the high prevalence of poor sleep quality in ESRD, research exploring its association with cardiovascular and renal parameters, as well as socio-demographic characteristics, is still limited. Therefore, our study aimed to investigate the relationship between sleep quality and both socio-demographic and laboratory characteristics in hemodialysis patients in Central Java, Indonesia. The methods that we used for our research. This was a cross-sectional study conducted from August to December 2016 across 3 dialysis centers in Central Java. A total of 123 patients undergoing regular hemodialysis were included. Sleep quality was assessed using the Pittsburgh Sleep Quality Index, or PSQI. It is a validated and reliable tool. Socio-demographic variables such as age, gender, BMI, and dialysis history were collected along with laboratory data, including BUN, albumin, potassium, triglycerides, cholesterol, and anti-HCV. For the analysis, we use the SPSS version 22, applying non-parametric tests such as Mann-Whitney and Kruskal-Wallis, followed by regression analysis to identify predictors of poor sleep quality. The next is about the results will be presented by Miss Yuniar Melisa Kisdayanti. Miss Yuniar, time is yours.
Thank you, Mr. Dio, for the time. Now I will look into our result. Yeah, our finding revealed that 88.6% of patients had poor sleep quality with a mean age of about 41.6 years old. And among demographic factors, sleep quality was significantly associated with age, gender, BMI, and the dialysis history. While the laboratory factor, it was associated with bone, albumin, potassium, anti-HCV, triglyceride, and cholesterol. Here, our table of bivariate analysis between the demographic characteristic and laboratory parameters with global PSK scores in ESRD patients. Move to our multivariate analysis, show that 4-factor remains significant predictor of poor sleep quality, consists of dialysis history with the coefficient regression 0.43 with the p-value 0.026, and blood urine nitrogen had shown the B 0.063 with a p-value 0.036. Similarly, the triglyceride has shown the score with the B 0.012 with a p-value 0.005, and the stronger associate was observed in cholesterol with a regression coefficient 0.014 with a p-value less than 0.001. And this suggests that cholesterol plays the most prominent role among the parameters analysis. And these results suggest that both dialysis related and biochemical parameters strongly influence sleep in ESRD patients. How about our discussions? In these discussions, dialysis history emerges as the strongest predictor of the poor sleep. The patients with more than 7 years on dialysis had significantly worse PSKI scores, likely due to the chronic inflammation, pruritus, and the pharyngeal edema, which contribute to sleep disorders such as sleep apnea. And the laboratory findings were also important. The high blood urea nitrogens level were associated with poor sleep, while improvements were observed with nocturnal dialysis in other studies. Similarly, the triglycerides and cholesterol were linked to poor sleep quality, supporting evidence that dyslipidemia and poor sleep together increase cardiovascular morbidity. Clinically, poor sleep quality can worsen systemic metabolic disturbance. It can be elevating the corticosteroids, increasing sympathetic activity, and fueling the chronic inflammations. It is also tied to depression and fatigue, which reduce compliance with the treatment. In research limit setting, these challenges are even more significant. And the management strategies can be pharmacological, such as the melatonin or anxiolytic, but dosing must be cautious in ESRD. Non-pharmacological options, including the acupuncture, acupressure, aromatherapy, and exercise, are promising and can be delivered by the nurses. However, the absence of the guideline and skepticism among the healthcare provider remains barrier. We move to our conclusions. To conclude, we found that poor sleep quality is highly prevalent among the ESRD patients, and it is strongly associated with dialysis history, bone, triglyceride, and cholesterol levels. Addressing the sleep quality is therefore essential, not only to improve the patient's well-being, but also to slow the CKD progressions and reduce the cardiovascular complications. However, because this was cross-sectional studies, causality cannot be established. We recommend the future cohort study and interventional trial to further explore whether the improving sleep quality can be positively influence patients' outcome. Here are the reference that we use. Ladies and gentlemen, this study emphasized that sleep is not just a basic human need, but also is critical determinant of health outcome in ESRD. As the clinical and researchers, we must ensure that sleep quality is addressed as part of the comprehensive patient care rights. And I would like to end with this quote: "When we treat sleep as a luxury, patients pay with their health. But when we treat it as therapy, we may save life." Thank you very much for your attention. I look forward to your discussions and questions. Good morning. Assalamualaikum warahmatullahi wabarakatuh.